The Center of Psychosocial Medicine was founded in 2005. It consists of 3 clinics: the Department of General Psychiatry, the Department of Psychosomatics and General Internal Medicine, and the Department of Child and Adolescent Psychiatry. We also have the Institute of Psychological Medicine and of Psychosocial Prevention. We live interdisciplinary collaboration to understand, to prevent and treat mental disorders.
What is unique is that we have a stepped care system of day care and of clinical care on the ward for special crises in cooperation of all the clinics of the Psychosocial Center. Therefore, we have not only a focus on families, but also on transition from childhood to adulthood. For all the age groups, we have the right way of treatment.
We have an inpatient and outpatient clinic for patients with severe personality disorders, particularly borderline personality disorder. And there we combine dialectic behavioral therapy with exposition therapy, and we often also include animal-assisted therapy.
We have created a special outpatient service that it's called At Risk, and it's especially for youngsters with risk behavior. We focus on non-suicidal self-injury and drug abuse, and we have an open door system to walk in. This is important because people need not wait too long to get into the service, and we have a low threshold to help young people.
The Institute for Psychosocial Prevention is an outpatient department. So we have a clinical focus on psychotherapeutic interventions and on the development of prevention. In the Eureka study, we try to understand and break the intergenerational transmission of abuse from one generation to the next, especially in mentally ill parents. So parallel to the inpatient treatment in psychiatry, they can learn to be a secure haven for their children and train parents to identify difficult situations that they can get in with their children.
Psychosomatic medicine is dedicated to recognize, understand and treat the interplay of physical and mental complaints in patients. We are exceptional in the treatment of anorexia nervosa patients with an extreme low body weight. We have run, with other university clinics, the so far largest clinical treatment trial in anorexia nervosa worldwide. And for this treatment trial, we have developed a new treatment manual for the disorder that is included in national and international guidelines.
We do not only focus on symptoms and diagnosis, we also have innovative biological therapies, including neurostimulation and neurofeedback, and broad expertise in psychotherapy.
My special interest here is research on voice hearing, on verbal auditory hallucinations across the schizophrenia spectrum and beyond. We seek to modulate brain activity that are critically involved in speech perception. So what we succeed in is to reduce overarching or heightened activity in specific brain areas, and we take neuroimaging methods, neurocognitive and neuropsychological methods to build up multiple predictive models that can actually inform us whether a patient may benefit from a specific intervention, be it neurostimulation, psychotherapy, or cognitive remediation.
Our research focus at the Institute of Medical Psychology is on the influence of close attachment relationships on individual health outcomes. fMRI neurofeedback is, I believe, a really fascinating approach to visualize how we can voluntarily modulate specific brain areas in their activation pattern. And with the real-time feedback, we can directly see how successful we are with increasing or decreasing activation patterns in our brain. When the participants in our clinical study managed to increase their brain activity in the reward-related brain areas, we hope that they also receive or perceive the interaction with their child as more rewarding in real life.
This center has really been at the forefront of understanding the neurobiology of maladaptive self and interpersonal function. This group has been very active in training and educating clinicians on the ground about how to utilize the alternative model for personality disorder clinically, and how to translate the research on maladaptive self and interpersonal function into a treatment of people with personality disorder.
We are on the way to identify patterns of behavior, of traits, of biomarkers, which can predict the response to treatment, and we will also involve digital interventions which can be offered in real time and in natural settings.
My hopes for the future are that we get specialized centers for young people where they get full service also on biological aspects, on psychological aspects, and also on social aspects to help youngsters finding their way into adulthood.